So I welcome you all to the warning signs, protect yourself from kidney disease session. Before I begin, I just want to point out that I would never call you, okay, to inform you about my live sessions. There are some people on the groups that would be trying to hack into your WhatsApp account by using my name. You know, they'll call you telling you that I'm hosting a session and that you should read out a code. Now, that code is a protective code. It's a passcode to your WhatsApp account. Okay, so they will copy down your number and then they would send a code to your number. And if you read out that code, then they would have access to your WhatsApp account. And then they would hack in and, you know, they will start asking your family members and friends for money. And because these people trust you, you know, they would want to help you. So they would send the money to the scammer. Okay. So please don't fall victim. I would never call you. Okay. The only time I'll call you is to check up on you to know if you are doing well, you know, health-wise. Okay. For those of you who are on the supplements, okay, I would usually call you from time to time just to check up. All right. So aside that, I would never call you to inform you about my sessions. Anything I need you to know, I don't need to call you personally to tell you. Okay, but I was saying that I would simply put the information on the group, okay? I don't need to call you to inform you about my Zoom sessions. So please protect yourself. Kindly turn on your two-step verification on WhatsApp, you know, so that you don't share that code with anyone. And this is not just, you know, for my groups as well. If anyone calls you and tells you to start reading out a code, please don't read out any codes to the person, okay? Be it your bank, telling you that they are from your bank, you know, different scenarios like that. Please don't read out any codes whatsoever to anybody, okay? They have no business with your one-time codes, you know, or your passcodes, okay? All right, so just to point that out, I'm thinking of ways that I can secure the groups, and some ideas are, you know, I'm brainstorming some ideas, but until I make my final decision, please protect yourself. Okay, please protect yourself. So today we're going to be learning about kidney disease. Okay. Yeah, let's get straight into it. So your kidneys are a very important organ. Okay. It's a very important organ for detoxification and for recycling and for removing waste products. Okay. So you get in contact with many different things, starting from your diet, oxidative stress, pollutants, you know, you going out every day, the things that you consume, you know, different things. So the work of your kidney is to detoxify you and to recycle, you know, your blood basically passes through your kidney, and your kidney will simply check through your blood to make sure that, you know, things that are supposed to be transported are transported, things that are not supposed to be in the blood are excreted. Okay, so that's the work of your kidney. And doing so, it helps to control your blood pressure, to make sure that you are hydrated. You know, it helps to remove some toxins and waste products. And it also helps with your drugs as well. Your kidneys play a very important role in your absorption of, you know, the chemicals that are in your drugs. Okay, that would help you, or should I say that help your drugs do what they are supposed to do. Okay, so it's basically for filtration. Okay, and this filtration happens in a part that we call the glomerulus of the kidney. Now, you're not studying medicine like me, so I'm not going to go into the, you know, the nitty-gritty of the anatomy of the kidney. But what you need to know is that it's simply for filtration and it's for detoxification. Okay, and this simply happens in the glomerulus and in the nephrons of your kidney. Now, I want you to see this photo here. This is your kidney, right? And you have this little blood vessel. Now, if you magnify this blood vessel, you have this, we call this a nephron, okay? This tiny thing here, when you magnify it, this is a nephron. And you have 1 million to 1.5 nephrons inside just one kidney, okay? So you can see that your entire bloodstream has to pass through this kidney, and it has to pass through this tiny part of your kidney that we call the nephron. Okay. Now the upper part of your kidney, we call this the glomerulus, and we call this the tubule. Okay. Now this glomerulus helps to filter your blood. Okay. Remove anything that is not supposed to be there. And then when the blood passes through this tubule, what the tubule does is to return any substance that you would need back into the blood. Okay. Like your nutrients, your protein, put it back into the blood so that you can use it for your cells, use it for energy, use it for body repair, and then eliminate the waste. Okay. So the glomerulus is like the filter, like your sieve when you want to prepare bread, when you want to prepare pancakes for your kids. Okay. You have to sieve the floor, right? So the glomerulus sieves your blood, of anything that should not be there. And then the tubule, this one, this part that I'm currently circling, okay? I don't know what to call it. Okay, the tubule. So that is going to simply return any nutrients that you may need, okay? Any important things that you may need that is supposed to be in your blood, okay? It would simply put it back where it's supposed to be. Mr. Thomas says he can't hear me. Can anyone hear me? I hope that you can hear me. My microphone is on. It shows that, it's getting my voice. Can you hear me, please? Kindly let me know in the chat, okay? Can you hear me? Hello? Okay, thank you for confirming, okay. All right, so this is simply the anatomy of your kidney for filtration and to put substances back where they are supposed to be, okay? Now, let's talk about a kidney disease. What is a kidney disease? Now, a kidney disease happens when this nephron that is supposed to filter and put, important substances back into the blood is no longer working as it's supposed to. When something happens to your body and these nephrons that are for filtration and detoxification, when they begin to die, when you begin to lose them in numbers. So remember, I mentioned that you have 1 million to 1.5 of these blood vessels, okay, these nephrons. When they begin to die, we call that a kidney disease, okay? So if you've ever wondered, what is this kidney disease even, okay? This is simply it. These tiny, tiny blood vessels that are supposed to filter your blood and make sure that you don't have any harmful substances in your blood, when they begin to die and you begin to lose them in numbers, that's what we call a kidney disease. And the number one cause of this kidney disease is diabetes, okay? So when you have high levels of sugar, it can damage these nephrons, okay? When you have very high levels of sugar, it causes them to die. And then these filters, it wouldn't work as it's supposed to anymore, okay? So imagine when you have, holes in your sieve, okay, when you're trying to sieve your floor, if you have holes in your sieve, bigger holes, then things that are not supposed to pass through would pass through, okay? So that's what high blood sugar does to your sieve, okay? It creates bigger holes, okay? And then what is not supposed to pass through would then pass through and, gets back into the bloodstream, and we don't want that. Okay, so diabetes, it would decrease that filtration rates. Okay, those larger holes would cause toxins, to remain in the blood, and it would then cause you to lose those nutrients. Okay, because those nutrients are, I would say, they are so tiny, it can easily be excreted. Okay, so those giant holes in your sieve, because of diabetes, it would then cause you to lose nutrients and retain the ones you are not supposed to retain. Okay, so it's kind of like the opposite, happens, when you have a kidney disease. Okay, so how do you diagnose a kidney disease? You would have to take a blood test and a urine test, okay, to diagnose kidney disease. Now, your symptoms are usually, before you experience a symptom of kidney disease, your kidneys would have been struggling 10 years prior to, your first symptom ever occurring. Okay. So I will definitely take you through the symptoms. Okay. But before you even experience these symptoms, 10 years before that, your kidneys have been struggling. Okay. And we know that diabetes affects 4 major areas. You have your kidney, your eye, the nervous system, and your arteries. And when you look at the anatomy of your kidney, you can see that you have so many arteries in here, and you have nerves as well within this nephron. Okay, so diabetes is the major cause of a kidney disease. All right. Okay, so let's move on. What is a kidney failure? Kidney disease, kidney failure, kidney stones, what are the differences between them? Now, a kidney failure happens very fast, and a kidney failure happens when you have had a history of kidney disease. And when you don't know these signs and symptoms of a kidney disease, you just overlook it. You just take it as, oh, it's nothing. Okay. And then all of a sudden, your kidney, it stops working. Okay. It completely stops working. You would have to either get a transplant or you have to get a dialysis, okay, to just keep you alive. Okay. So a kidney failure happens when, you have been experiencing a kidney disease for a very long time. And then all of a sudden, your kidneys cannot take it anymore. These nephrons, they eventually die off. And then, you can imagine the amount of toxins that would remain in your body because you don't have a kidney working anymore. Okay. And because of that, you then have to get either a kidney transplant or, or get on dialysis. If not, you are going to lose your life. Okay. Now, what is a kidney stone? Kidney stones happen when minerals and substances in the blood crystallize. Okay. A major cause of this would be your blood sugar. Okay. So I want you to just imagine, sugar as in its solid form, even though that's not how it is in your body. But think about sugar. You know how crystal-like sugar can be. Okay. So when you have these minerals and substances roaming around your bloodstream, and your kidney is trying to filter your blood and it comes in contact with the kidney, it can crystallize, it can come together and form these stones. Okay. And it would usually come out of the body by urinating, but then it would be extremely painful. Okay. So that's what a kidney stone is. Basically, crystal solid substances that have been roaming around in your bloodstream, when they finally come in contact with your kidney, it blocks, and it decreases how well your kidneys would function. Okay. All right. So that's what a kidney stone is. Now, if you've ever heard of a polycystic kidney disease, that's simply a genetic disorder. Okay. So it's in your genes and there is nothing much that you can do about it. So it's either you are born with it, in turn, it would progress, as you get older. Okay. But it's simply a genetic disorder. And what happens is that these cysts, think about it like acne, okay, like pimples, but then they are on the surface of your kidney. Okay, so it will develop on your kidney and it will cause your kidney to start swelling. Okay, and it will then lose its function over time. Now, they are not cancerous, but they can have very damaging effects to the kidney. Okay, so they can also vary in size. Some are large, some are small. And, you find them on the surface of the kidney. They just cause the kidney to swell. They inflame the kidney. Okay, make it larger than it's supposed to. Okay, and then, in turn, the nephrons will begin to lose their function, over time. Okay, so those are the different types. These are the most popular ones. Definitely you have other ones. Okay, but these are the most common ones that you would hear. So when you go to the hospital, God forbid, if you ever hear that, you have a kidney disease or a kidney failure, I don't wish that for you, but at least you would now know the terms. Okay, this is what it means. This is what a kidney disease means. This is what a kidney failure means. This is what a polycystic kidney disease means. This is what a kidney stone means. Okay, so this is simply what happens in your body when you hear of these terms. Now let's get into the warning signs of kidney disease. Okay. Now you want to catch a kidney disease early so that it doesn't progress into a kidney failure where it is irreversible, and it doesn't progress into a kidney stone where you may likely have surgery to take it out. Okay. So it's good that you catch the kidney disease when it is still, before it even gets chronic. Okay. Kidney disease is like the first stage. Okay. So it's better that you catch it when it's still a kidney disease as opposed to when it grows into something bigger like a kidney failure, and you would have to then, rely on dialysis to keep you alive. Okay. So let's talk about these warning signs. The first thing you have is nocturia. Okay. The word nocturnal means nighttime. Okay. And urea simply means to urinate. So this means that you are urinating frequently, especially at night. Now, this is not just that, you get up every night to pass urine, but it's extremely difficult for you to hold urine at night. Okay. Extremely difficult. Sometimes you may want to urinate, but you love your sleep. You're like, oh, I'm going to pass it out, when I wake up in the morning. But for those that are dealing with nocturia, it's extremely difficult for them to hold their bladder. Okay, you have to pass out that urine. So that's one of the warning signs that, look, your kidney is not functioning well. And remember, you would only experience these signs 10 years, 10 years prior to, or 10 years after you have started, your kidneys have started struggling. Okay, so when you experience these signs, it means that you are already far gone. Okay, so nocturia is one of them. Another one is a metallic taste in your mouth. Okay, so when you are talking and your breath smells like ammonia, if you've never smelled ammonia before, or maybe you've forgotten what ammonia smells like, just think about a dead rat. Okay, or think about your gas leaking. Okay, that's one of the smells of ammonia. Okay, so when you talk and you have this metallic taste, or you have this ammonia breath, okay, it's one of the warning signs that you should not ignore. Okay, and a major cause of this is because the toxins that your kidneys are supposed to excrete from your body is now, is being retained. Okay, and because these toxins are not supposed to be there, you have this metallic taste and ammonia breath. Okay, and number 3, we have protein aversion. Now, this is a great dislike of protein, especially meats. Okay, where you dislike all sorts of protein foods like beans, fish, meat, all protein foods. You just have this dislike. Okay, so that's one of the warning signs as well. Okay, you can imagine a Nigerian, somebody who is used to eating meats, all of a sudden you have no desire whatsoever to eat meat. Okay, that's one of the signs that, you have been struggling with a kidney disease. Now we have nausea/vomiting. I know nausea/vomiting is one of it's a very common symptom. Many things come with nausea or vomiting. Okay. Now, when you experience nausea or vomiting alongside, things like nocturia and things like a metallic taste and protein aversion, then you know that, okay, it's linked to, a kidney disease. Okay. Now, itchiness and loss of appetite. Like I've mentioned, you may have a sudden dislike for protein, and you may also not want to eat anymore. Okay. And you also experience some itchiness, in your body, okay, on your skin. All right. Now, number 6, you have hypertension. The reason for this is because of the high force of your blood vessels. Okay. So hypertension, usually it can come because you are suffering from a kidney disease. And it can also come as something that would cause you to have a kidney disease. That is, let's say you are diabetic. And because you are diabetic, you have hypertension. Hypertension would now cause you to, hypertension would now cause your kidneys to, get damaged. Or you have a kidney disease, then it leads to hypertension. Okay, so you can see diabetes, hypertension, kidney disease, high cholesterol, all these things, they are kind of like in a circular motion. When you suffer from one, you suffer from the other one. When you have high cholesterol, you have high blood pressure. When your blood sugar is high, you have hypertension, then you are likely to suffer a stroke. You know, they are just in a circular motion. Okay, and we call this the metabolic syndrome. Okay, so it is best that when you are suffering from just one of them, you do your best to control it as much as possible so that it doesn't progress into, the worst diseases that are in the metabolic syndrome. Okay. Now for number 7, we have a swollen face, feet, and hands. Now we simply call this edema. Okay. Now, your kidneys filter blood. That's their work, to filter the blood and to remove anything that's not supposed to be there. Now, when you have these good proteins in your blood, okay, proteins that are supposed to, carry your hormones are not just spirits in your blood. They are carried in something, and that's your protein, okay? Things like your enzymes, it's carried in a protein. So when these proteins are very few, when your liver doesn't produce enough and they are very few in your blood, which means that you are passing very little nutrients, you are passing very little hormones, you are passing very little enzymes in your bloodstream. What it would do is it will now cause, water to be retained in the tissues. That is, it would reduce the amount of water in the blood vessel, okay? And it would push it into the tissues, push it into the cells, push it into the cells that are on your legs, that are on your hands, that are on your face, okay? And it will then cause it to swell, okay? So you have this excess fluid, excess water in your tissues, okay? Because your kidneys are not filtering enough fluid, okay? So that's simply what we call edema, okay? Excess fluid in your hands, your feet, your face. Now, you have edema when you press your skin on your leg, your feet, or your face. When you press your skin down, for a few seconds or a minute, and there is a dent there, okay? If you just try to press your skin, okay? Maybe on your hands or your feet, just try to press it. It doesn't go inside. There is no dent inside. When you press it, it just returns back to normal. But when you have edema and you press that skin, you press that layer of your skin that is swollen, you will see that there is a dent there. And it will take a while for that dent to return back to normal. Okay. It's just like a bouncy house, okay, a bouncy castle. When you bounce on it, it just pops back up. That's how your normal skin should be. But then when you have edema and you press it, it stays there. There is a dent there. Okay, that's how you know that you have edema. And edema is one of the symptoms that you have been suffering from a kidney disease, because you would have these symptoms 10 years after you have started struggling with a kidney disease. Okay. Another thing is a uremic frost. All right. Now you have something called urea. Okay. Urea is an unused protein. Now your body doesn't store protein as your body would store glucose. Okay. Your body turns glucose into fats. Your body wouldn't store protein. It doesn't store protein. It doesn't store fats. Okay. Sorry, it doesn't store protein like it would store your carbohydrates and your fats. Okay. So when your body is done using its proteins, it's meant to excrete it. Okay. And that's the major component of your urine. Excess protein that your body doesn't need. All right. Now, your body needs to get rid of that urea because it doesn't store protein. Okay. Now, that urea needs to leave and it cannot stay in the blood. Now, if there's a situation where your kidney cannot take that urea out of the blood and it remains in the bloodstream, what happens is that your other excretory organs, like your sweat glands, they will try to do the job of your kidney. Okay, they will try to do the job of your kidney by removing that excess urea that is not supposed to be there. Okay, now when you excrete and you start sweating, and all of the water component of your sweat evaporates, this urea that is part of the sweat now, it would have this whitish frost on your head. Okay, I have attached a photo here, just in case some of you experience it already. You have this crystals, okay, like frosting on your forehead, especially, okay, or on your head. Okay, we call it a uremic frost. And this is one of the clear signs that, look, you have been suffering from a kidney disease and you have to do something about it before things get worse. Okay. Another symptom is exhaustion. Okay, exhaustion, like you are just waking up in the morning and you are already exhausted. You can barely work. Okay, and this is simply caused by, again, too much urea in the blood. When your body, your kidneys are not able to pass that urea out. Okay, pass that urea in your urine. Okay, so the cause of this is, like I've mentioned, bad filtration. Bad filtration, where you are sieving your floor. The floor is your blood. You are trying to bake a cake. The floor is your blood. And because of diabetes, you now have these holes in your sieve. And so it causes the bad filtration. And what's not supposed to be part of your floor would now be a part of your floor. Okay. So urea in the blood can cause you to have exhaustion. And the only reason you would have urea in your blood is because your kidneys are not functioning properly. Okay, your nephrons are dying, they are losing, they are being lost in terms of numbers. Okay, so before you lose everything in an instance of a kidney failure, it's best that you do something about it. Okay, now another symptom that we have is albumin in the urine. Okay, albumin is a protein made by your liver. Now, albumin is good. You know how you think of cholesterol as good and bad, right? Think of albumin as a good protein, okay? So albumin is a protein that enters your bloodstream and it keeps your fluid from leaking out of your blood vessels into other tissues, okay? That is, it carries hormones and vitamins and enzymes throughout your body, keeps them in the blood so that they can, be channeled into their right places and not, everything being packed into one tissue like you have with edema, okay? So I hope that we understand that. Albumin keeps excess hormones and vitamins and enzymes away from tissues that have had enough, okay, so that they can be channeled into the right tissues and cells, as opposed to everything just being jam-packed, inside one cell, okay, or one tissue, in the case of edema, okay? So when you now lose this albumin in your urine, when you now lose this good protein that is supposed to help you, keep things in check in the bloodstream, make sure that you are transporting enough enzymes and hormones, when you then excrete it, out as urine, you now know that, there is a problem with your kidney. Okay, so this is one of the symptoms of a kidney disease. All right. Now, the last symptom I have for you is low vitamin D. Okay, now your kidneys convert vitamin D in its active form. When you tell your kids, go out in the sun, go and get vitamin D, all those things, okay? Vitamin D doesn't just you don't just absorb it from the sun or from your supplements or from your food just like that. You need your kidneys to turn it into its active form. Now, if you have low vitamin D levels, it's either because you are not consuming enough vitamin D, or you are actually consuming vitamin D, but because your kidneys are not functioning as they are supposed to, it's inactive. Your vitamin D is left inactive in your body, okay? So without good functioning kidneys, vitamin D cannot be made active, okay? And if your vitamin D is not active, it causes you to have a deficiency of vitamin D. And deficiencies of vitamin D, what's the word? They expose themselves in terms of hardening of your arteries, in terms of kidney stones, calcium building up in your arteries, in your nerves, in your eyes. It's so stiff, that blood can no longer pass through easily. Okay, and that's what will cause your BP to rise. All right, so low vitamin D is one of the symptoms. You would only have low vitamin D for two reasons. It's either you are not consuming it, or you are consuming it, but your body is not converting it. Your kidney is not converting vitamin D to its active form so that you can make good use of it, okay? And one of the purposes of vitamin D is to lower your BP, okay? So when you have a low vitamin D, one of the reasons for that is that you are suffering a kidney disease, but you do not know it yet. All right? Okay. So I've been talking for a while. Can you let me know if we are together before I move on to the next part of the class? Are we together? Do you understand? Are we here? Are we present mentally? Kindly let me know. Okay. Okay. All right. So how do you know? How do you measure a kidney disease? How do you know if you're having a kidney dysfunction? Okay. Now, the first thing you want to do is to measure your glomerular filtration rates, a GFR. Okay. So you can go to the clinic and tell them that you want to know your GFR just to know, if your kidneys are healthy and if they are functioning well. Okay. So that's the function of a GFR, to measure how well your kidney acts as a filter. Know how well your kidney acts as a sieve, which is what it's supposed to do. Okay, know how well your kidneys are performing. Now, one of the things, when you take that GFR, okay, when you take that urine test, when you take that, that's urine test or that GFR test, when you take it and you see that you have high creatine levels in your blood, that's not a good thing, okay? And when you have high albumin in your urine, that's also not a good thing, okay? So remember I said, think of albumin as the good protein that is supposed to stay. So when you have your good protein in your urine, meanwhile, it's supposed to be in the blood, you know that that's a problem. And when you have your creatinine, which is the bad protein, which you are supposed to have in your urine, but you have it in your blood, you know that your kidneys are not functioning well as they are supposed to. That means that your kidneys are not filtering very well, okay? And that's a sign that a kidney disease is either coming or that you are already suffering from one, okay? So this is how you know. If you've ever asked, how do I know? With all these symptoms that you have mentioned, how do I know if I'm struggling with a kidney disease? This is how. Go and check your glomerular filtration rate, okay? And then you screenshot this slide. When they give you your urine test or your blood test, you find out, is my creatinine level in my blood okay? And is my albumin level in my urine okay? All right, so that's how you know. Another way is your urine albumin to creatinine ratio. Okay, so these two things, you measure the ratio between them. If it is less or equal to 30 milligrams per gram, it means that you are good to go. Okay, if it is more, then it means that the good protein is out of where it's supposed to be. Okay, and that means that you may suffer from, or that you are suffering from, a kidney disease. Okay, so you can either check your GFR or you take a urine albumin to creatinine ratio. Okay, so you may want to screenshot this slide, if you are interested in checking out your kidneys. All right. So, okay, Rita, you have talked about kidney disease and its symptoms. What can I do about it? Okay. It's a problem. What can I do about it? So the first thing you want to do is to handle your blood sugar and insulin well. Okay. The major cause of a kidney disease is diabetes, okay, or even pre-diabetes. So the first thing you want to do is that you want to make sure that your blood sugar is in check and also that your insulin is in check. Now, doing that is not just via your medications, because your drugs add more toxicity to your organs in an attempt to help you, okay, especially to your kidneys. Okay, your kidneys are what I would say break down your medications, break it into small bits, release all the chemicals that are in there so that they can then be passed through the bloodstream and do what they are supposed to do for you. Okay, so your kidneys are the main stop of your medications. All right, now you want to handle your blood sugar and insulin well. Okay, not via more and more medications, but in a natural way. Okay, and one of the ways you can handle your blood sugar is first, stop putting sugar into your body. Okay, and you do that by lowering your amounts of carbohydrates, your amounts of sugary foods that you eat, your amount of fructose, okay, that you consume. All right, now another way you can handle your blood sugar well is to stop eating. Okay, now a very, very simple way to go about your intermittent fasting is you can skip your breakfast and eat your first meal of the day, your normal meal of the day. Eat that at 12 p.m. Okay. And then at 5 p.m., you can then have a bowl of salad. That's the simplest and easiest way you can go about your intermittent fasting. Okay. So that's simply how you lower your blood sugar and your insulin as well. Because remember, if you listen to my sessions on diabetes is not just your blood sugar. Your blood sugar is something that your body works very, very hard to control. Okay, it's just like you do a lot of work to make sure that you look good. You know, when somebody looks at you, you take care of your skin, make sure that you shower, you brush your teeth, you brush your hair, put on nice clothes, put on a good perfume. Okay, outer appearance is good, but perhaps inside of you is not so good. So your blood sugar is like the outer appearance. Okay, diabetes is not just about your blood sugar, because your body does a good work in trying to manage your blood sugar well. Okay, you cannot tell if you have diabetes from just your blood sugar alone. No, you know you have diabetes by your insulin level. Okay, by how much insulin is being produced to manage that blood sugar and keep it in a desirable range. Okay, that's how you know if you're diabetic or not. So you can check your insulin levels to know, you know, if you are pre-diabetic or if you are diabetic. Okay, before you are then pronounced and before you are, you know, you are now a full-blown diabetic patient and you start running helter-skelter. You know, check your insulin levels. Okay, you do that by taking a HOMA IR test. I will put it in the chat now so that you can know it. A HOMA IR test. That's how you check your insulin levels. Okay, at the hospital. Just tell them you want to have a HOMA IR test. Okay. All right. And how do you manage your diabetes properly? First, stop putting sugar in. Okay. If your house is flooding and the roof is open and rain is falling, if you want to clean up, the first thing you have to do is to cover that roof. Okay. Close the roof first before you then start mopping the water. Abi? So that's the same thing with diabetes. If your body doesn't process sugar well, the first thing you want to do is to stop putting sugar into the body first. Okay, before you then start cleaning up your body system. Okay, and you do that by a low carb diet and then practicing intermittent fasting to burn out the sugar that is already stored. All right, and you do that by practicing intermittent fasting. All right. Okay. Now, another thing you want to do is to consume lots and lots of plant-based foods, okay? They really, really help with the complications of a kidney disease. They help give you a lot of antioxidants that would help to manage your blood glucose effectively, okay? Consume lots and lots of leafy vegetables, all right? Okay. Now, another thing you want to do is B1, vitamin B1, okay? The medical term for this would be benfotiamine. I had to put hyphen here so that I don't embarrass myself when I come on live and I am unable to pronounce this word. So benfotiamine, okay? That's a medical term for vitamin B1, okay? So you have to consume vitamin B1, all right? That would really help you with, first of all, the complications of diabetes, okay, because that's a major cause of kidney disease, and then oxidative stress as well. Okay, oxidative stress simply means that, you know, it's not everything that you can cure with your food. Do you know that it's not every disease that you can cure with your food? Please let me know in the chat. Are you aware that it's not everything that you can cure with your food? I want to know if you know that it's not every disease that you can cure with your food. Please let me know in the chat. Are you aware of that? Okay, okay. All right. So things like your sleep matters. things like your stress level, especially those of us that are in Nigeria, your stress level matters a lot, okay? Things like your gut health matters, okay? So the things that you are exposed to every day, you go out and then, you know, you are in traffic all the time, and then a trailer passes and then smoke is everywhere, and you inhale all those things, okay? It's not everything that you can cure with your food, because some of these things, they are caused by oxidative stress, of which your food did not cause it. Now, you need those antioxidants to help you battle that oxidative stress, okay? And you simply get these things from things like your plants and, you know, your supplements, etc. All right, but oxidative stress is one of those things that we don't talk about enough, okay? One of the things that we do not talk about enough. And your food, yes, it can add to it, especially when you don't eat well, okay? Imagine if you're already battling with the world, and then what you are putting into your body is also garbage, okay? When you are battling with the outside world, your body is just trying to survive, and then you are not even helping matters by consuming healthy food. You are putting in garbage to make things worse, okay? So your oxidative stress and your antioxidants come in, you know, to assist your body battle things like stress, things like you not sleeping well at night, okay? You're not having a good functioning gut health. All right. Okay. Someone is writing on my screen. I have marks on my screen. So I'll stop sharing and share again so that the marks can go. Okay. All right. So another thing you can do to help you with kidney disease, apart from vitamin B1, is your alpha lipoic acid. Okay. Remember, kidney disease simply means that those blood vessels in the nephron, let me go back again. Okay. Kidney disease simply means that these blood vessels are not working as they are supposed to. These tiny, tiny, tiny blood vessels. You can even see a nerve here. If you follow my blue pointer, you see this nerve right here. Okay, things are not working fine. All right, so you have your alpha lipoic acid that would help you with that. Okay, it's also an antioxidant as well. All right, another thing is turmeric. Okay, turmeric. Turmeric contains a very powerful compound that we call curcumin that is helpful, okay, in reducing the complications of diabetes that would then help you with your kidney disease, okay? So diabetes is kind of like the center of attention here when it comes to kidney disease, because it's the #1 cause, all right? Now, if you are suffering from kidney disease, one thing you want to do is to consume more salt. Now, I know for hypertensive patients, this can come across as, why are you telling me to consume salt when I'm hypertensive? Okay, but the thing is, you do need salt. You need your salt, okay? It's a very, very important electrolyte, all right? And it enables your muscles to function. It enables your nerves to fire, okay? You know, your nerves are not blood vessels. They pass on information, and it's like electric information, kind of. When you want to lift your hand, okay, your nerves have to pass information within that nanosecond, okay, where you have the thought of even raising up your hand, okay? So you need your electrolytes to function. And because your kidneys are already damaged, you need that salt to help you with your nerve function, okay, and also your muscle function. So what do you do if you are hypertensive and you are running away from salt? Get low sodium salt. The reason you're running away from salt is because of the sodium content, right? So get low sodium salt, okay? That would help you. There are various brands that produce low sodium salts. We have low salt is one of them. Sea salt is one of them. So maybe I will put out some of these recommendations for you, okay? Maybe via emails as well as the group chat, okay? Some examples of low sodium salts that you can consume, okay? You can replace that with the normal table salts that you have in your kitchen, all right? So salt is one of those things, a low sodium salt to help you, okay? And lastly, you want to stay away from high carbohydrate foods. You want to stay away from junk foods. You want to stay away from processed foods. You want to stay away from refined carbohydrates. Okay. You have no business licking ice cream at this stage of your life. You have no business in a fast food restaurant. Okay, at this stage in your life, you have no business with Fanta and Coke. You have no business with it. Okay, so please stay away from junk foods, processed foods, high carbohydrate foods. Okay, that's the point. Diabetes is not just sugar or you consuming table sugar. Okay, because your carbohydrates eventually get turned into that glucose. All right, so stay away from high carbohydrate foods as well. I know it can be difficult because that's the only thing we eat in this country. Okay, if you're not eating rice, you're eating yam. If it's not yam, it's potato. If it's not potato, it's spaghetti. Okay, so we have a lot of high carbohydrate foods and very, very low protein foods and also very low fat foods. Okay, so you just do your best, okay, to reduce your portions of carbohydrate foods and then practice intermittent fasting. All right. Okay. Now, another thing you want to do is to keep away from foods that have high oxalates. Now, when you combine oxalates plus your calcium, you have oxalate stones, and this eventually progress into what we call kidney stones. Now, what are some of these foods? They are healthy foods, though, but they contain high oxalates, okay? If you are already struggling with kidney disease, remember the section of this class that we are in right now is what can you do if you are already suffering from kidney disease, okay? One of the things you should do is to keep away from foods that have high oxalates, okay? Things like your beet leaves, your kiwi fruits, your almonds. You may want to keep away from your nuts and seeds as well. Your beans, you may want to keep away from those things, okay? Because it can combine with calcium in your bloodstream and then cause you to have these kidney stones, okay? Now, the easiest way for you to prevent kidney stones, let's say you eventually eat your almonds, you eat your kiwi, you eat your beetroots. Let's say you eat them whilst you have kidney disease. A simple way for you to make sure that you don't have kidney stones is to drink 2.5 liters of water every single day. You know this big bottle that has these calibrations on it, okay, that help you drink water? Buy it, fill it up, take it to work, take it everywhere you are going, okay, and drink water. It would help you prevent those kidney stones. All right? Okay. Uh-oh. I'm seeing comments like there is no audio. Can you hear me, please? Can you hear me, please? Okay. Okay. So it's just from Mr. Sunday. All right. So let's move forward. Now, what are you going to do for those of us that are not suffering from a kidney disease at the moment? What are you going to do? What are some of the foods that you're going to eat that would help you prevent a kidney disease from happening? The first thing is your leafy vegetables. So I put the best three here to help you prevent a kidney disease: asparagus, kale, and celery. Okay. Now, all leafy vegetables that come in leaf form, any vegetable that is like leaf, anyone that you can shake like this, like your, my camera is not on. And I'm saying anyone you can shake like this, but you get what I mean. Things that are like in leaf form. Okay, that's what you call your leafy greens. Okay, anyone that you can shake. Cabbage, lettuce, your ugu leaves, water leaf, bitter leaf, all those things. Okay, your leafy vegetables, they would help you with to prevent a kidney disease from happening. Okay, and you also want to consume protein. All right. So consume things like your fish, your seafood, and your meat as well, okay, to help you with your protein levels. All right. Now, there is this, for those of you that already suffer from kidney disease, please take it down. There is this supplements that can really, really help you. Okay. I do not sell it, but it can really, really help you, okay, with your kidney health. So I will type it down now. You can just check Google, okay, and get it for yourself. That's if you're already struggling from kidney disease. All right. So we call it renal food supplements. Okay. So I don't sell them, but they are very good for your kidney health. Okay. So in addition to, your doctor's prescription and your medications, you can take this alongside to help you improve your kidney health for those of you that are suffering from kidney disease. Okay. All right. And this is the end of our session today. Please ask me your questions. All right. And if you don't have questions, we are done. We are done. So thank you for joining me live. Okay. Please ask me any questions, if you have questions, and if not, we are done for the day. And I am very, very happy that a number of you are here. Some people I already know, like Reverend Ceci. It's so nice to see you. Mrs. Chioma, Mrs. Justina, Mr. Jerry. I'm so happy that you are all here with me live. Mr. Victor, Mr. Sunday, Mr. Thomas, Mr. Uchenna as well. People that I'm familiar with, okay? It's not like I don't appreciate the other people that are here, but I'm just familiar with them. Mr. Oshobu as well, regular commenters, on the groups, and also my emails, Mr. Cletus, Engineer Samson, Mr. John. Thank you. I'm very happy that you are here with me live, okay? All right, please ask me your questions if you have any. And if there are none, the encouragement really helps me, honestly. I can see your comments already. Thank you. It really helps. It really, really helps. Those two words, thank you, it goes a long way, okay, for me. You're welcome. Okay, so questions? Questions. Okay, Mr. Kennedy says, does having a GFR that is less than 90 doesn't mean the person is likely to develop a kidney disease? Well, not exactly. It can be one of the warning signs, okay? It can be one of the warning signs, and actually it's greater than 90. I think what you are referring to is your urea creatinine to albumin ratio, all right? So when you take your GFR, it's quite different from when you are taking your, let me go back to the slide, please, so that we are on the right track, okay? I'm coming. Let me just put the slide. Okay, so when you take your GFR, if it's greater than 90, then I wouldn't say that it means that you have a kidney disease, but it can be one of the warning signs, okay? And if you take your albumin to creatinine ratio, all right, if you have more than 30, when you take your urine test, then it can be a sign, but that doesn't mean that, you are already suffering from that, okay? So your tests, yes, they are important, okay? But that doesn't mean that if you have something that is greater, then it doesn't mean that you are then suffering from a kidney disease, okay? So your GFR readings, okay? Normally it should be 90, okay? But then if you begin to have lower levels, or you have extremely high levels, then it's something that you should, you should be worried about. However, it doesn't necessarily mean that you have a kidney disease already, okay? I'm saying this because anything can cause your kidneys to not function properly. That wouldn't necessarily mean that you have a kidney disease already. Perhaps you are lucky that you are finding out in, the early stage, okay? And you can do something about it. because having a kidney disease means that you have already lost a few nephrons, okay? So it doesn't exactly mean that, you know, you are already suffering from a kidney disease, okay? All right. So I hope that that's clear, okay? All right, I have a lot of questions, so let me just take the comments one by one, okay? Mr. Jerry, I would send to the group, okay? I would send low sodium salt examples to the group. Mrs. Ngozi, the only thing I would do for you is to simply interpret your test. If you send a test to me, I will simply interpret it for you, okay? Maybe advice like, okay, what can you do about it? Sure, no problem, okay? But this session already covers what you should do, okay? So if you send me your tests, if your doctor did not interpret it, the only thing I'll do is to simply interpret it for you, okay? Yes, I would send the replay to the group, okay? Low sodium salt examples, I will send to the group as well, okay? And also via email. Please, is it possible for kidney problems to aggravate? I think high blood pressure is what you mean. And yes, yes. Hypertension that's not caused by kidney disease can cause you to have a kidney disease. And kidney disease can cause your BP to increase as well. Okay? So it's kind of like in a loop. Okay? So for those of us suffering already, what can be done to reduce creatinine levels? Okay. So we have to go back now to the slides. You see this what to do section here. This is what you do if you're already suffering from a kidney disease. Okay? All the things I mentioned here, what you should do, what you should abstain from. Okay? To improve your creatinine levels, the problem is not that your creatinine levels are high, but that your kidney filtration is poor. Okay? So what you want to do actually is to improve your kidney health. It's not necessarily about reducing your creatinine level, all right, but improving the overall health of your kidney. When you improve that, then your creatinine levels will reduce. All right. Oh, you're welcome, Engineer Samson. We already spoke on Paul. Thank you so much. Mrs. Sharma says, I had a kidney checkup recently. Everything was fine except for low vitamin D. Does it relate to the kidney? Not necessarily, ma. So remember I said you can have low vitamin D for two reasons. The first is that you are not consuming enough vitamin D. So what you simply do is to take in more vitamin D, okay? Now, you can also have low vitamin D when you are already consuming enough vitamin D, but your kidneys are not functioning properly, all right? So the first thing you want to do is speak into your life positivity that you don't have a kidney disease, okay, by the grace of God, all right? And consume more vitamin D, okay? And if you do that, and your vitamin D levels improve, then that means that your kidneys are working fine. Okay. So what you would do now is to give yourself about 3 to 6 months and target sources of vitamin D. All right. And improve that and then go for another test. Okay. To go for another test and see if your vitamin D levels have improved. Okay. How do you detect albumin in the urine? You simply do that by taking your urine test, okay? That's how you detect it. You have to take a test. Okay. Control measures for diabetic patients. Okay. That's simply the slide that I am on right now, okay? So when I release the replay, you can go back to the session, okay? You can go back to the session and see how you can improve your diabetes, okay? I also have some diabetes sessions available. So you can go through my Facebook or my YouTube channel. It's simply my name, Rita Manafa, your wellness consultant, both on Facebook and YouTube. Okay, I've given out some really nice videos on managing your diabetes effectively. Okay, however, I have included some of the things that you should do that would help you with your diabetes. All right, things like handling your blood sugar, your fasting, eating leafy green vegetables as well. Okay. All right. Can one be taking water while on intermittent fasting? Sure, you can. You can take your water. Okay. Even your cinnamon tea can help you suppress hunger whilst you are fasting. Okay. So you have these hunger suppressants that can help you. Yes, you can definitely take them. Okay. That's not to say every time because, you know, you're trying to abstain from food. All right. But yes, your water, definitely you can. Okay. What could be the cause of lack of sleep or shortness of sleep and waking up every morning not refreshed? So many things. So many things. The first thing you want to do is take a look at your environment. Okay. And make sure that you are in a nice environment that is conducive for sleep. All right. To help to boost your melatonin. Another thing you want to do is to keep away from your phones a few hours before you attempt going to bed. Okay. Try reading a book before you go to bed. All right. Now, other things that can help are your omega-3 acids that would help you with your sleep. Okay. Another thing can be sleep apnea. Okay. Sleep apnea. That is when your breathing sort of stops while you are sleeping. Okay. It's one of the reasons so many people, especially those people that snore, okay, it's one of the reasons why they don't experience a good night's rest. Another thing can be a lack of vitamins, okay? Like your vitamin K, your vitamin E, all right? That would help you with your sleep. So many different things. Your environment matters, your diet matters. You can take some supplements to help you, as well as your sleeping pattern as well, okay? All right. How do you improve the kidney health? You improve your kidney health first off by managing your blood sugar, regardless of if you are diabetic or not. Okay? Manage your blood sugar. And then you can do some of the things I've mentioned here, like your eating pattern. Let me go back to my slides. Your leafy green vegetables and your protein. Okay? That's one the two things that can help you with your kidney health. All right. And if you're already struggling, then you can make use of the previous slides. All right. So, Mr. Emmanuel, I don't know if you were able to hear me throughout the presentation. I think you said that you were not able to hear properly. So when I'm done, I would release the replay. Okay. And then, you know, you can take your time and watch at your convenience. Okay. Which is better to carry out a kidney test, blood or urine? I would say both, ma'am. Okay. Both, because if you think about it, your kidneys they target the two, both the kidney and the blood. Sorry, both the urine and the blood. Okay. It's that filtration in the blood that determines what is being passed out as urine. All right. So I would say the both of them are important. Okay. All right. Any more questions? Any more questions, please? Yes, sure. You can definitely have supplements to help with your vitamin D levels. Yes. You're welcome, Mr. Jerry. Thank you. Any other question? If there are no more questions, you can leave. Okay. Yes. If you have edema, if you have edema, okay, it can be a sign. Can be a sign. Not that it's what is the sole symptom of determining if you have a kidney disease or not. Okay. So it can be a sign. Another thing that can prevent kidney stones apart from drinking water is to simply observe healthy kidney health practices. Okay. Which is everything I've mentioned in this session. Beginning with your diet, managing your blood sugar, practicing intermittent fasting, and the rest of them. Okay. The only reason you would have a kidney stone is if your blood vessels are rough, that would then allow those crystals, to be stuck. Okay. It's just like friction. If there's no friction, you can't drive your car. Okay. So there has to be some form of friction in the blood vessel as well that would allow things like a kidney stone to be stuck, to your on that is to the surface of your kidney blood vessel. Okay. If not, you just urinate it. I don't know if you understand what I mean. Okay. If you don't have that opening, sort of, you will just pass it out. Okay, because they are usually very tiny. Yes. And you do urinate some kidney stones. When you have them, you can pass them out, but it will be very painful. So if there is no friction, if your kidney blood vessels are elastic, and if they are as smooth as they are supposed to be, to allow easy passage of blood, then you wouldn't experience kidney stones. Okay, so kidney stones start from your kidney health in general. Okay. Okay. Any other question? All right. Any other question? You're welcome. Thank you for joining me live. If there are no more questions, we can leave. Okay. So I would simply stop sharing now. Do I wait a few more minutes just in case anyone has any other questions? All right. Yes, I would send you a replay to to your email and the WhatsApp group as well. Okay. All right. So I will end the session now. Okay. Since there are no more questions coming in. All right. So have a good evening. Take care, everyone. Good night. Bye.